welcome to our special show, Coronavirus Facts versus Myths. Here we get you all the very latest on the coronavirus pandemic, the latest research, and alert you to the fake news. We also get you the biggest interviews of the most prominent researchers and public health experts. Today, joining us in the show is Dr. Ravindra Mehta. He is Senior Consultant Pulmonology, Interventional Pulmonology and Critical Care Medicine in Apollo Hospital. Now, a Delhi police officer tested positive for coronavirus again after recovering from the disease just 2 months back. Now, the official, who was 50 years old, had tested positive for the virus in May and was treated at a hospital between May 15th and 22nd. Thereafter, he had tested negative and resumed duty. However, on July 10th, he again felt unwell with a fever and dry cough and got himself tested on July 13th. The case of a relapse has baffled experts and doctors treating him and has raised the question whether a recovered patient can contract the infection again. Listen to what the experts have said in this case.
कुछ दिन पहले भी 2-3 महीने पहले मई में और ये कुछ साउथ कोरिया से और चाइना से रिपोर्ट हुए थे, करीब 90 के आसपास साउथ कोरिया से हुए थे। लेकिन फाइनली जब पाया गया कि नहीं, ये लाइव वायरस नहीं है, तो RT-PCR ने अगर डिटेक्ट किया है तो इसका ये मतलब नहीं कि वो लाइव वायरस ही है और वो पर्सन इन्फेक्शियस है जी। बहुत दिनों तक जो है ये वायरस जो है, उनके डेब्रिस जो हैं पड़े रहते हैं थ्रोट में और RT-PCR उनको डिटेक्ट कर लेता है तो पॉजिटिव रिजल्ट देता है। क्योंकि ग्लोबल अगर हम एविडेंस देखें, पूरी बात करें तो पूरी दुनिया में 1.5 करोड़ के आसपास लोगों को हो चुका है अभी तक, बट री इन्फेक्शन अभी तक नहीं हुए हैं जो प्रूवन हो री इन्फेक्शन। सो इसलिए इनकी बहुत ही कम संभावना है।
अभी तक तो ऐसी कोई रिपोर्ट साइंटिफिक जगत के सामने में नहीं है कि दोबारा हो सकता है करके। चर्चा जरूर चल रही है पूरे विश्व में कि दोबारा हो सकता है या नहीं हो सकता है, लेकिन जो हमारी वैज्ञानिक पर्चियाँ जो छपती है जर्नल्स में, किसी भी जर्नल में आज तक ये नहीं है कि किसी को कोरोना हो गया फिर वो आदमी दुरुस्त हो गया, उससे पूरा तो रिकवर कर लिया और बाद में दोबारा हुआ। ऐसा कोई अभी तक कोई पर्ची आई नहीं है अभी तक। तो आज के दिन तो ये नहीं मानेंगे कि दोबारा हो सकता है। नहीं, अगर वायरस पॉजिटिव किसी को हो तो उसमें एंटीबॉडीज बनने के चांसेस बहुत ज़्यादा होते हैं।
Earlier, we spoke to Dr. Ashish Jha. He is the director of Harvard Global Health Institute, on whether immunity to the virus disappears and leaves one exposed to reinfection by the virus. Here is what he had to say.
Yeah, so there's been a lot on immunity to this virus, and I've seen that study, of course, and I am not as worried, and I'll tell you why. There are many aspects of the immunity to this virus that we don't understand. Antibodies are one part of it. There's also something called cellular immunity or T-cell immunity that is not being measured as well, and I suspect that that's going to play an important role. So what I say to folks is, let's right now let the science work itself out. My best understanding of all the scientific studies is people definitely have immunity for some period of time. The virus is new, so I can't say whether it's going to be for 3 months, 6 months, or a year. It may be that there's a small proportion of people who don't develop much immunity, but I think most people who get infected are going to have immunity for at least some important period of time.
This issue is something that is worrying people around the world, but the experts are right now saying that the evidence is too low to worry about it. There are very few cases that we are seeing, and there could be many factors playing a role in these issues. There are questions of how effective or sensitive were the tests that were used earlier in the first time that they were tested positive. How sensitive were they when they were discharged, and at that point of time, the test that was conducted to say that yes, they are free of corona, how sensitive were they at that point of time? So these questions still remain. So reinfection is something that we cannot base on just one case in Delhi. Now, let's talk about something else, which is vaccination. This becomes important because to protect us from any kind of infection, a vaccine is important. Now, there is a wave of anti-vaxxers who have been refusing to get their children vaccinated, and now seemingly a new propaganda about the pandemic is being spread. COVID pandemic is being called a conspiracy to depopulate, and even an attempt by the billionaire and philanthropist Bill Gates to make money from selling vaccines. Now, there are even some who are suggesting that Trump administration's top scientist, Dr. Anthony Fauci, may have created the coronavirus. Now, fabricated news articles crafted by conspiracy theorists are targeting Gates and Fauci and have gained traction online with hundreds of thousands of believers. It's important to understand the impact of vaccines. You can't just negate them. We're just trying to explain to you how in 1978, smallpox was completely eradicated from the world. And this is because of just one vaccine. This disease has existed on the face of this earth for 3,000 years, killing lakhs of people annually. And just a jab of needle removed everything. We are going to show you the power of vaccine. It seems that the mass memory is short-lived and we have forgotten how preventable diseases like diphtheria, tetanus, polio, measles and whooping cough, which used to kill thousands of people every year, not just in our country but entire world, have been completely removed. These are the graphs that are showing you, the lines that are showing you how exactly these diseases have, the number of cases have fallen down after 1980. Mass immunization program in India was introduced in 1978, and see the graph of every single disease falling down post 1980. This is a proof that vaccines do work, not just in our country. We're talking about other countries as well. Take a look at how exactly polio cases and deaths have fallen in America ever since vaccination was introduced. This is the first polio vaccine that was given. See the difference. And in 1963, oral polio vaccine was invented and they started giving it to the children there. Look at the fall in the graph. In 1979, polio-free declaration was given to US. Now, this is a very clear pictorial depiction of how vaccine has helped all vaccine preventable diseases. Let's move on and answer your questions, which we will be doing in a little while, but let's first meet the newsmaker. Now, we bring you exclusive interviews on a range of issues related to coronavirus with leading health practitioners across the world. And today, Dr. Ravindra Mehta, Chief of Critical Care, Pulmonologist, Apollo Hospital, joins us. Thank you very much, Dr. Ravinder. Let's first begin with the fact that, earlier it was thought that this is just a respiratory illness. But now it is emerging with evidence that it can affect other organs as well.
So it's interesting. The simplest lay analogy could be it's a thief which enters through your front door, but it ransacks every room in your house. Any organ and every organ is potentially possible. The good part is most people are still respiratory, but as they get sicker, sickness obviously means that the virus is having a field day in your body. In such a situation, it can go anywhere, and on the ground we're discovering that. So the main challenge is obviously for people to understand that if you get the severe form, it can actually create problems in many areas. And for healthcare providers, open your eyes so that you can anticipate, understand, and try to mitigate the damage of all these areas.
Doctor, we are learning more about the impact it has on young people also. And also there are reports of impact on young children, Kawasaki disease amongst the children. Now, what would you say about that?
Then answering the young people question, that's another thing. So, we were also complacent that at least there'll be a certain population, say 10 to 50, 10 to 45, who won't be afflicted by the virus as much, or at least if they're afflicted, they'll be the simple carriers, no big deal, and so on. So then the data started coming from UK and US. So typically Italy and all gave us that shift, China and Italy. But the UK and US gave us a different spectrum. Italy, if you look at it, has a very large elderly population. Elderly population, smoking, drinking, and who really don't think a lot of all these social distancing measures. So we saw that deluge. Now we shifted to UK and US, the numbers were massive. So when your denominator increases, then we realize that even the younger people are getting infected.
Right, doctor, it is said that children don't get this disease easily, and initially because of that we weren't really worried, but now there are reports of other complications like Kawasaki. Now this gets a little worrying, especially thinking about the fact that schools might be opening one day.
Right. So children are the good part. Let's talk of the good part is less affected, minimal percentage worldwide agreed on basically. And the initial concern was they are asymptomatic carriers and are spreaders, but that also is coming down. It's not that bad basically. But on the other hand, when children get affected, so first of all, most of the time it's going to be okay. But when you get affected, it looks like these delayed complications are being talked about. Good news, it's not common. It's just that because it's happening in children, it puts a high alert. You don't want to see anything wrong in kids, right? So when these things are talked about, that's when the high alert is going. But I wouldn't put that as being a major change in the understanding of how many kids are going to get infected. Now, because the stakes are high and you don't want to see any child affected, that is why schools are going to be cautious. Secondly, look at the effect of your measures. Try your best to do social distancing and all this mask and sanitization in children. It's impossible. So you can't do much about it. The stakes are high, and then you really are wondering whether this is really essential. So until you know more of your protection, it's quite likely that the schools will take the maximal possible precautions, school, state, policy makers, and this will be something to factor in. So this is news on the ground coming in. Now let's look at the rest of the population, the 10 to 40 or 10 to 50 population. That is one of the big concerning thing. We start off saying it's not bad. 0.3, 0.5 mortality, not bad at all. They're going to get over it. But now UK, US showed us the younger are getting infected. UK had some ballpark figure of 3% or so. Come to India, we're seeing more and more. And then you wonder why India? Well, understand there's multiple factors. There's geographic factors, first of all. Then there is, our environmental factors, and there is our lifestyle.
Right. Doctor, let's also talk about the whole concept of monoclonal antibodies. Recently Dr. Fauci of America also spoke about it. What do you think about that?
So it's these, basically, I think what we're talking about, these two agents called tocilizumab and itolizumab. These have come beyond that, whatever is the highest level of research. At least these two drugs have hit practical application. One of the things which came out is this thing called cytokine storm. Again, one of those newer, descriptions of this virus that this was not seen before in prior viruses or not described. So it is that, I'm smoldering around with my COVID. I'm okay so far, but suddenly it takes a bad turn. And when it takes a bad turn, the cycle of the inflammatory cycle takes such a bad turn that I go very sick all of a sudden. And that inflammatory cycle itself will take me down. In such a situation, suppressing the inflammatory cycle with these anti-cytokine storms. Cytokine is a fancy word for inflammation marker. So I have a bunch of these bad guys running in the body who've run amok. Storm is because all of them have come together and made me worse. And so if the drug which can try and suppress that, it may improve my outcome. And so that came out, and this was this anti-rheumatological monoclonal antibody. It was quickly deployed. So the whole story of COVID-19 is pick out from the closet what makes sense as per the understanding of the disease and throw it in right now. Okay, so this drug was thrown in, again used extensively. Again, the data is plus minus. It's made it to consider this drug. It has to be considered, and more people are wondering, some people it helps, some people it doesn't. However, typically because we were desperate, it's been used and it's out of stock again. It's gone. So again, we have to get it back in, and again, if something goes out of stock and its demand is high, we'll get into the same stories of black marketing and so on and so forth.
Right. So that's all about the treatment. But what about the vaccine, doctor? Are you hopeful about it? What kind of a timeline do you see then by when we will see a vaccine?
Different people have different components of the virus and at different evolutionary stages, and they're trying to race through depending on that, the preparation and the regulatory part and their human trials. So that is what we're hoping for. Good news, never seen such a colossal effort and so much energy and money put into it. Concerning news, the virus seems to be waning its immunity in regular people. We are finding out that after 3 to 4 months, people's immunity is waning. So if your immunity is waning, will this vaccine be effective? How long will it last? Is it a possible strategy? What are the side effects? How often will you have to do? And how many people you need to vaccinate? Mass production? All these are questions on the ground. So again, we live on hope. We're going to look for this space, but we can't bank on it. We have to have everything else ready with us.
Well, we're going to take a very short break now. When we come back, we're going to answer your questions. Dr. Nangia will be joining us to answer your questions. And also, we're going to tell you how India is faring as far as growth rate is concerned. Short break now. Welcome Welcome back, and now it's time to answer your questions. And for that, joining us now is Dr. Vivek Nangia. He's Principal Director and Head Respiratory Critical Care Medicine in Max Hospital. Thank you very much, Dr. Nangia. Let's listen into the first question. Vihan Bajaj is asking the first question.
My name is Vihan Bajaj. Can I go to cycling without mask?
Okay, Dr. Nangia, he's extremely worried about the fact that he can't go out cycling. So, is it safe with the mask on?
So, Anjali, thank you for asking me this question. Vihan, that was a very sweet question, really. And lots of kids are asking these questions these days. In fact, even adults who want to go out exercising and cycling, I mean, they're finding this, rather than going into the gyms now, this is a safer modality of exercise. So, I would only say that when you are cycling outside, of course, one is that you can go out cycling. Second is that when you're cycling outside, be sure that you're away from people. So then if you're away from people, then you don't even need to wear a mask. But the moment you get off the bicycle and start interacting with somebody, that is when your mask should come back. So while exercising in the open, outside, there is no need to wear a mask as long as you're maintaining a safe distance from people. But the moment you come close to somebody, then immediately the mask should be back in its place.
Right. So if you're going alone, then not a worry. But if you're going in a group, then I guess the mask has to be there. Okay, let's take our next question.
Hi, my name is Prashant, and as we know that there will be a second wave to this pandemic, so my question is, what more precautions can we take to be safe from this virus, as we know now it is airborne?
Doctor.
Right. So, we've always known that it could spread through contact. Then it was that it could spread through droplets. And now we know that it also spreads through air. Air means that if somebody has coughed, sneezed, or even spoken or laughed loudly, even then the virus could be dispersed in the air, and through this air, it could be transmitted to everybody else in the room. But usually you have to see the distance. That would all depend on the size of the droplet, that how large the droplet is. It could it could spread for about 6 feet, and it could stay in the air for about 3 to 4 hours. And during that period, if it gets transmitted through the air conditioning duct, then yes, there's a risk of transmission even into the other rooms, wherever if it is a common air conditioner that is serving the purpose. So we'll have to follow the standard protocols of hand hygiene, contact precautions, wearing a mask at all the times, and maintaining a social distance from everybody. Those are the various precautions that we would need to take, and these should be true especially for those who are elders, those who have an underlying heart disease, lung disease, any other immunosuppressive disease, cancers. So they have to be even more careful. We have to be prepared that this virus is here to stay, and so are these precautions. So we have to adapt to this new style of living now.
Absolutely. This is the new normal, as we keep saying, and you can't let your guard down. Thank you very much, Dr. Nangia, for answering these questions. Let's take a look at how exactly coronavirus is increasing in India. Now, there is a growth rate that is a parameter of that. If we look at India growth rate, if we look at 4 weeks back what it was, there is a significant change that we can see now. There is almost a twofold increase in that growth rate. About 4 weeks back, it was 1.9%, but now, on 26th of July that we last recorded, it was 3.6%. That's a huge increase in a month. Now, why is this important? This growth rate, if you compare it to the rest of the world, some of those nations which are reporting the maximum number of cases like US and Brazil and Russia, let's take a look at the worldwide comparison. Now, this is how we are going to show you. First, let's take a look at America and keep an eye on that curve also at the bottom. So 1.7%, this is a country which is reporting more numbers than us, but look at the curve, it is slightly flattened. Brazil, now Brazil's growth rate has increased in the last 3-4 days. It was in 1% something and now it's 4%. So it's increasing. Now take a look at India's curve. As you can see, the curve is going up. It was slow earlier, but now it is going up, which is quite evident from the number as well, 3.6. Now let's take a look at Russia, which is number 4 in the world tally. Look at that growth curve. It is completely flattened now. In fact, we are seeing a slight dip there. 0.7%. That number shows you that Russia has managed to control its growth rate. Compare all these growth rates with the average, the world average. 1.3% is what the world average is. This shows us India has a huge task in front of it. We cannot be, lackadaisical in our approach. We cannot sit on it. This clearly shows our numbers are increasing. So that's all we have for you in this show today. We're going to take a short break. On the other side, we bring you news updates.